Welcome back to Better Than a Pill. Today, I am so excited to have Kristin Mallon as a guest with us today. And Kristin is a certified nurse, midwife, and a menopause specialist. And today, we're going to be talking about longevity and how it works. So, welcome, Kristin.
Thanks, Carly. Thanks so much for having me. I'm so excited to be here.
I am excited too. So, let's start off a little bit. Tell us a little bit about how you got involved in the work that you do.
Yeah, so I've been a midwife since 2006, and I always was in private practice. And I started in Brooklyn, and I started really with a passion for working with women really throughout their whole lifespan. I really wanted to kind of work with a woman from their fertility, getting pregnant, delivering babies, and then on through menopause and beyond. And I kind of noticed that once women were kind of done with their reproductive longevity, they were really focused on their primary longevity or their main longevity or their full longevity. And that became like a really fun thing to kind of work on with women, and some women choose not to have children or don't have children for various different reasons. And so that was always a really interesting thing to kind of just work on right from the get-go with all different types of women at all different times in life. But it's definitely been something that I've focused on in the second half of my career, as like it kind of applies now to all of the clients that I work with now. And it's something that I think as women kind of go through the transition of menopause, it becomes more poignant as they go through that transition.
Absolutely. I know I'm interested, and I'm sure all of our listeners are as well. So tell me, how do you define longevity and how does it work?
Yeah. So longevity, I think as a group, people who practice longevity medicine, I think are kind of collectively coming to define it as an expansion of health span and an expansion of lifespan. So it's this not just living longer, but living better, because nobody wants to have a longer life if that means just spending, another 10 years in a nursing home or disabled, or another 10 years after a stroke or after some sort of immobility situation. So that's really what we're focused on and a lot of times it's called the marginal decade or the marginal 15 years of life, the last 10 to 15 years of our lives, really making those so where we can still sit on the floor, take our bag and put it in an overhead bin, travel, go on a hike, play tennis, and do the things that we love. So it's kind of like getting an extra 10 years of life, really, to still have the same mobility and mental acuity that we have in our 50s and 60s at 90 or 100.
Yeah, that sounds good to me.
Yeah,
100,
sign me up.
sign me 100%. And I like what you said. It's about the quality of that time too.
Yes.
And so what do you see, or what are the keys to longevity?
So if you ask me what I think the number one thing is, I would say it's movement, exercise, so much of what you are all about. And I think that there's just no ifs, ands, or buts, no way around this. We can talk diet and supplements and molecules until we're blue in the face, but movement, exercise, stability, mobility is the number one thing when it comes to longevity. So it's not really, some doctors even say it's not really even worth having a conversation if we don't get that set first. That's really the foundation of all aspects of longevity. From there, I would say that what we put into our bodies is probably number two. So that there's a lot that goes into that. So not just diet, but supplements, nutraceuticals, including hormones and hormone supplementation, what we put on our skin, the shampoos we use, the laundry we use, etc., things like that.
Yeah, that totally makes sense. And I love how movement is the number one pillar. Wow.
Yes. Yeah. I mean, and movement encompasses so many things. And I think movement can mean so many different things to so many different people. And we're so different and we're so unique. And I certainly don't think there's any one size fits all. I don't think that it has to be, well, everyone has to do zone 2 and zone 4 and Pilates and yoga and X and Z and Y. I think it can be as beautiful and unique as we all are, can be as beautiful and unique. And that's why I like to say movement as movement means to each of us.
Yes, I agree 100%. Exactly. And it is such a unique facet. And it's often, I feel, overlooked by doctors. They just assume it as one big generic thing, exercise, when there's just so much more involved, even within that, realm of movement and so forth.
Yeah, absolutely. And I think I remember, I don't want to be misquoted and, the fact checking will probably be difficult on it, but I remember somebody once looked it up that exercise is like 5 times more effective than the next pill for certain things when it comes to cardiovascular prevention and Alzheimer's and dementia prevention and bone loss and osteoporosis prevention. And I would believe that. I mean, I could see how that could be true. So I just think that there's even, I think, a study going on now, and I can't remember what study it is. I wish I had it in front of me, but where exercise is meant to be, or movement is meant to be, the number one recommendation for all across the board, across all ailments. So, okay, well, you have depression and anxiety. Okay, well, before we try even cognitive behavioral therapy, before we even try, an SSRI, or before we try any of the traditional remedies, we're going to try movement first. And okay, you have high blood pressure, we're going to try movement. So I think that that's going to be a really fascinating study to see what the results of that study are.
Oh, wow. Absolutely. 5 times. That's really powerful too. And,
Yeah.
you know, and it really sits well with me because I feel, even in my own work that I do with people, that's the number one place we start. And I know not everybody sees it like that. So it just adds fuel to my fire. That's great.
Yeah. Yeah, absolutely.
So what shortfalls did you see in women's healthcare, but particularly in those middle age, that prompted you to do the work that you're doing?
Yeah. So, I mean, where do we start? I mean, there's so many things. There's so many things that I think need help in women's healthcare. So Dr. Peter Attia, huge doctor in longevity medicine, probably one of the leading doctors, I think, in our area, certainly one that I look up to the most. And he talks a lot. He wrote a book called Outlive. He was on Oprah recently. He talks about medicine 2.0 versus medicine 3.0. So medicine 2.0 is kind of the old way of doing things, how we've always done things. And it really focuses on sick care. So you don't go to the doctor until you're sick, and you go to the doctor every year. You're supposed to go to the doctor every year. A lot of us don't, because and I understand why we don't, because it's like, well, what's the point? Like, what am I getting out of it? They're just waiting until I'm sick, or they're waiting until my blood values or my blood pressure or my data or my vital statistics are at a level where I'm sick, and they're not helping me with the prevention range. And that's really medicine 2.0, what Peter Attia describes. And what his vision is he's like, let's move to medicine 3.0, where we're looking at someone's data and we're looking at their vital statistics and we're looking at the information that's presented to us in terms of like all sorts of different things. So in terms of like for movement, like VO2 max and pulmonary function tests, and we're looking at their cardiolipid profile, and we're looking at micronutrient testing and even like gut microbiome testing. And we're saying, okay, this person isn't sick, but are these levels optimal? So I think that that's a question that we're like, so at Femgevity Health, which is, my company, that's what we're asking now. So we're like, okay, obviously, well, hopefully most women that are coming to us aren't sick, or if they're sick, they're just like on the very fringe of sick. They're just starting to get sick. So we're helping women optimize their health, as opposed to treating sickness and treating chronic disease, which is where medicine 2.0 is today. I think also when you come to women's health has just been boxed into OBGYN. So OBGYNs they have had so much loaded on their plate. It's amazing to me. I think and I'm so in awe of what, I'm a certified nurse midwife. And so my colleagues are all OBGYNs. I'm amazed at what they have had to take on. So they've had to become experts in childbirth. They've had to become experts in all the surgeries that go along with childbirth. They've had to become experts in gynecology and all the surgeries that go along with gynecology. They've had to become experts in primary care, because a lot of women use them as primary care doctors. So now you're talking about not just what's going on from like yeast infections and UTIs, but now upper respiratory infections and ear infections and, the things that happen to us in any given year, most women are going to their OBGYNs for that, or a lot of women do. I wouldn't say most, but a lot of women do. They're also supposed to be experts in menopause and endocrinology and breast experts, breast health. So I think it's like, I'm just in awe of what has been dumped on their plate, I feel like, as opposed to in traditional medicine, you would never go to a cardiologist and say, okay, fix my endocrine system. And oh, by the way, fix my osteoporosis and also fix my, urogynecology issue. All of those subspecialties in medicine have been specialtied out. And I think we're starting to see this. We've done such a great job as a society. And I know there's work to be done on breast cancer, but we've done a really good job. I think we should celebrate how far we've come with breast cancer and breast cancer awareness. I think a lot of us know the statistics of breast cancer. We kind of have a very good prognosis now. The survival rate is very, very high for breast cancer. Most of us know we should go get a mammogram at 40. We know how to handle breast cancer. And now we have breast specialists. That's a subspecialty of women's health. And so what I'd love to see, and what I think might be coming, is I'd love to see OBGYNs subspecialty out. Obstetricians are obstetricians. They focus on pregnancy, childbirth, and high-risk pregnancy. Gynecologists are gynecologists. And you see a lot of this happening on their own. A lot of times you hear people like, oh, I don't do OB anymore. I just do gynecology now. Like they're subspecialtying on their own. And then I'd like to see GYNs become menopause specialists, and I'd like to see them become specialty in hormone balancing for women, and the same way that we have breast specialists. So I think that that's kind of what one of the follies, I guess you could say, in women's health is that like we've just been like, women's health, no big deal, like just women, no big deal. Like one doctor can handle all of these things, but really we need multiple subspecialties to handle the intricacies and the complexities that go along with all of these really complicated issues. I mean, fibroids is very complicated. Endometriosis is very complicated. Ovarian cysts is very complicated. And most of the time you have GYNs who specialize. I mean, I know a ton of GYNs who just do endometriosis and that's all they do. They just do robotic endometriosis surgery. And that's really, I think, where we're moving to. And I think we're heading in the right direction. But I think that's one of the things that's happened in women's health that's kind of where I see Femgevity has started to fill the hole and fill the gap of we've kind of fit into the niche of hormone balancing and helping women with perimenopause, menopause, and getting their hormones in line and what to do when that happens.
Yes. Wow. So a couple things. Could you say the name of the doctor one more time? Dr. Is it Attia?
Yeah, Dr. Peter Attia, Attia. I think his website is peterattiamd.com or peterattia.com. And his book is called Outlive.
Okay, great. And then your company, tell us a little bit about the Femgevity. And this is the company that you founded. Tell us a little bit more about that.
Yeah. So my co-founder, Michelle, and I, so this really came about because so I was working in private practice in New Jersey, and my patients were getting older. They were kind of, started in 2006. And in 2006, my patients were 20s, 30s, and 40s. And then, every decade since then, they've gotten older and, their needs have changed and I've evolved with them. And as they kind of started to move into their 40s, 50s, and 60s, they just had different needs. And, I kind of looked for resources and I felt like I was looking for other colleagues to help me support them through the different hormonal changes that I think happen to women each decade. Because I think sometimes we think about, okay, well, it's really just menopause, but really every decade, a woman is going through hormonal shifts. So what happens from 0 to 10 is a certain hormonal shift, and what happens from 10 to 20, and what happens from 20 to 30. And I think women they know this, because if you're like, okay, how was your period in your teen years versus how was it in your 30s? They're like, oh yeah, totally different. Like, I totally know what you mean. Hormonally, I was very different. And, I was looking for colleagues to kind of guide me to guide my patients, and there just weren't any. It was just like a desert of nobody knew what to do. And I think there's a lot of reasons why, and I'm happy to get into that too, as to why nobody knew what to do. But I had an old colleague of mine from my very first job, Dr. Michael Abrahams, Harvard trained. He's a brilliant, brilliant doctor, and he knew what to do. And he had been working with women in hormonal shifts and hormonal changes, using bioidenticals, using HRT, using supplements, using herbs. He had been working with midwives and naturopaths for a very long time. Very, really, really, really brilliant guy. And he started helping me and coaching me and educating me. And so then we kind of started treating women together. And he was like, no one in the US is really doing this. You have to look to European literature, and you have to look to the literature from Australia and New Zealand. And that's kind of how we started to kind of treat women that needed hormonal supplementation, needed hormonal support, needed hormonal balancing for lots of different things, not just perimenopause and menopause, but PCOS and weight gain and premenstrual syndrome, lots of different things. And that's why Michelle and I started Femgevity, is because there wasn't anything out there for women like this. They're just, OBGYNs are, like I said in the beginning, so overloaded as it is. Like, they're so busy doing all of these different things that we're just dumping on them as a society. Like, okay, do all of these things, handle all of these different types of medicine, that they just don't have the time to understand all the intricacies of hormone balancing as well. So that's really why we got into it.
Great. And that provides an additional tool and additional information to help women see where they are earlier before, let's say, disease sets in.
Yeah, absolutely. And then also, hormone balancing helps to prevent a lot of longer term complications. So, when you do hormone balancing properly in your 30s, it can actually prevent things like fibroids in the 40s. And then when you do hormone balancing in the 40s, it can actually prevent cardiovascular and osteoporosis in your 60s, et cetera. So that's why hormone balancing and longevity go together so nicely and really well.
So it's a key component for longevity for women, obviously.
Yeah, absolutely. Well, there's so many benefits to hormone supplementation and hormone support in the 40s and 50s for the 60s, 70s, and 80s, like primarily with cognition and Alzheimer's, cardiovascular, and bone loss prevention, like really significant health benefits.
And it's a mixture, it sounds like, of also integrating in some natural modalities, natural medicine, in addition to mainstream medicine tools. Is that correct?
Yeah, well, everybody's very different. And so it's really about, we call it hormone support. So we really, everybody can do that very differently. Some women need full hormone replacement therapy, and some women can do that with herbs and nutraceuticals and everything in between. A lot of women we do best with bioidenticals, but again, it runs the whole gamut. And, it's kind of like this double-edged sword, I think, because, I get a question a lot about, like, well, you're giving, you're a midwife, and aren't you supposed to be natural, and you're supposed to support natural childbirth and natural aging and natural menopause. And yes, it is, to go through menopause without any hormone support is natural, but it's also natural to age, and it's also natural to die. And so, like, these supporting hormones is also a way to kind of like ease that transition and kind of like make it kind of extend lifespan and extend health span, to make it just kind of make life a little bit better, if that's what women want. It's just an option.
Sure. And I wouldn't see why they wouldn't, right?
Yeah, absolutely. Well, to each woman their own.
Right. And it's interesting. But so menopause, obviously, you've touched on, it affects our bones. And, so we're looking at decreasing risk for osteopenia, osteoporosis, and then also mental health. To talk a little bit about how this can help with, because menopause does affect our mental health, correct?
Yes. So I'm so glad you brought that up and given me an opportunity to talk about it. So one of the things that I think as a society we don't really think about when it comes to menopause specifically is we don't really think about the 4 other main hormones. So there's many, many, many hormones that are involved, many sex steroid hormones, I should say. There's many more hormones. I mean, with insulin and thyroid hormones, but there's many, many other sex steroid hormones that are involved in the perimenopause and menopause progression that go down over time, not just estrogen, estrone, and estriol. And those hormones that are really affected are progesterone, DHEA, and testosterone. And those start to go down in the late 30s. And very specifically, progesterone and testosterone going down can have profound effects on sleep. And then when you're having these profound effects on your sleep, really in your 40s, and a lot of women don't realize that this is happening to them because, women who don't track their sleep. So I use a sleep tracker every single night. So like I know about it. I use the Oura Ring. I'm a huge data person in general. So I love data on myself, but women don't realize that they're losing deep sleep and that they're losing REM sleep until they start to have symptoms. And usually that's like years into the process where they've been losing sleep. And then once they start to have symptoms, that's going to affect their mental health usually, or their mood. And then this is where we can get symptoms like rage, anxiety, depression, feelings of hopelessness. We can even start to have new symptoms of OCD. I mean, a lot of symptoms will start to come up in the 40s, very specifically in this perimenopausal time, because of the loss of progesterone and testosterone and DHEA, or a combination thereof. And it's very different for every woman, and how it manifests is very different for every woman, but a lot of it is related to the lack of deep sleep and the sleep loss. And I think that there's so much that can be done to educate and prevent, just to kind of be aware that to track the sleep, to track hormone progression, to track hormone loss progression, and then to consider hormone support during this time can be really, really, really effective and really helpful for mental health and mood stabilization. Yes, of course, traditional therapies are great. All the therapy modalities that we have, all of the pharmacologics that we have for mental health are wonderful. But it's also great to consider hormone support for women in their 30s and 40s that are going through any type of mental health challenges during that time in their life.
Wow, that's powerful. With the relation to sleep. So I track sleep, and I'm just curious, how much deep sleep does a woman over 40 need?
Yeah, so this is a really great question, and I know that this is going to sound really hard, but really 90 minutes would be ideal. So 90 minutes a night to 2 hours. Yeah.
Okay.
And most women a lot of women, like sometimes when they come to me and they're tracking, they're getting like 30 minutes and they're scared. And it's okay, because it doesn't, like, I don't want women to think like, oh my gosh, I'm tracking. I've had some women come to me that are getting 8 minutes of deep sleep. And it doesn't matter where you're starting, because there are a million things that can be done, and there's a plethora of things that can be done. So I don't like to put this like huge lofty goal of like 90 minutes out there and make everybody kind of nervous if they're getting way under that. I think that like tracking is the best way to kind of, so you know what you're working with, and then start to work in the different types of modalities to get that deep sleep up. It will do wonders for not only hormonal health, but mental health, weight loss, hair growth. I mean, there's so many things that can come from getting the right amount of deep sleep.
Now, that's great to hear, because generally we think about, okay, we need 6 to 8 hours, maybe 9, but we never hear about the deep sleep component. So I'm going to start tracking that.
Yeah. And everybody has different chronotypes. And so there could be, there is a chronotype of 4 hours of total sleep. And I think that chronotype, I think the deep sleep marker is around 30 minutes. That's a very rare chronotype. That's a genetic genotype. So, there is variation within this. And so it's a definitely rough range, but that's something that we could evaluate at Femgevity, or you can get evaluated with someone who understands how to look at genetics or genetic markers and can help you evaluate the different stages of sleep, and to let you know, like, okay, you're a 6 hours a night sleeper, like you need 6 hours a night. Okay, well, that means you need 50 minutes of deep sleep, or that means that you need 45 minutes of deep sleep. So working with someone who can read those different markers and understand how to help you. And really, you want to try to get as much deep sleep a night as possible, really.
I see. And so there is the component of not everybody. There are people that are outliers that only need 4 hours of sleep, is what you're saying.
Yeah, very, very rare. So I would say that it's probably, you're probably talking about like 1 in 5,000, I don't know, 1 in 10,000 people. So I don't want to, that's why I never like to say like a one size fits all for anybody, but there definitely could be outliers in any given situation. Definitely. But yeah,
And then
roughly it's 8 or 9 hours. There are a few people that could go on 4. Some people can go on 6. Some people need 10 to 12. But that's kind of
gotcha.
like the rough range, so to speak.
Yeah. So that makes sense. And so, because again, sleep is individualized. And then you mentioned there's also the genetic component to that.
Yep. Yeah, there's genetic, there's certain genetic markers where people need less sleep and more sleep too.
So what else do you think that women can do to prepare for menopause and optimize the overall transition, if you had to give some simple things that they could do starting today?
Yeah, so I think it's different for each decade, but if someone's in their 30s, let's say, I think it's great to get a baseline hormone testing to know where their hormones naturally fall at both stages in the menstrual cycle. So a woman who's still ovulating and still having menstrual cycles would have, there's the luteal phase and the follicular phase of the menstrual cycle. So the first half of the menstrual cycle and the second half of the menstrual cycle. So it's good to get hormones done during the first half and hormones done during the second half of the menstrual cycle to kind of see where the hormones naturally fall. Even if a woman doesn't have a uterus, she's still, and she has ovaries, she's still ovulating. And so it's good to kind of track those hormones in the different parts of the menstrual cycle to know, or the ovulatory cycle, to know what's normal for her and how she kind of feels normally in her 30s. The same thing in the 40s, to kind of have that data. So that's a great thing to know. Secondly, it's great to, as the decades go up. So like I said, I really think about women hormonally by decades. So in the 30s, it's good to kind of start to work on building muscle mass. And then that becomes more important in the 40s. We usually need to increase the amount of weights we do. So, when you're in your 30s, you can usually get away with lower weights in terms of weight training. In 40s, we want to kind of increase the weights we do to put on more muscle mass, because muscle mass will help us to burn more glucose and help us with insulin resistance, will help to fight off lower abdominal weight gain, that like kind of, extra weight gain that happens around the mid abdomen as we get into our mid 40s and late 40s. It's great to establish an exercise routine or find an exercise that we enjoy and that we like, and establish good eating habits, and then continue to track your hormones on usually a yearly basis in your 40s to know when you might need to add in hormone support.
I see. Yeah, that totally makes sense. And again, we have the movement piece in there as a key component to that.
Mm-hmm.
So yeah, no, this is great. And I think the work that you're doing is amazing. It's awesome. And we need more of this out there. Like when we started off, a lot of times people just don't know what is available to them, and it's too late, because like you've described, and I've even experienced myself, is that the medical system today is overwhelmed and they're not able to get all their needs met, nor do they know that there could be other ways to test for things. And so, I hear this all the time. I was, talking to a neighbor last night. I may even have her on the podcast eventually, but just an example, an extreme story is she's been going to the doctor for 3 years, not feeling well. And all they say is, your every blood tests are coming back normal. Everything's fine, until it got so bad. And finally the diagnosis of ovarian cancer, it had to get to that point. And, that could have been prevented earlier.
Yeah,
and
absolutely.
I'm sitting here thinking to myself, wow, so yeah, something has to be done. And I think what you're saying about things are moving in that direction, and you are also with your company in alignment with that. So this has been great. And I thank you so much for coming on here today. I think everything you shared has been wonderful. And thank you so much for sharing all of your knowledge with us.
Yeah, thank you so much for having me on. It's been a pleasure.
And for all of you listening today, if you want to learn more about Kristin's work, I will be including the link to her website as well as all of her social links in the episode. And remember, we do new episodes every week on Wednesday, and I look forward to having you join me then.